Hey, today we're talking about bronchitis. Bronchitis is a common respiratory condition that affects millions of people around the world. It occurs when the lining of the bronchial tubes, the airways that carry air to and from your lungs, becomes inflamed and swollen. This inflammation leads to coughing, mucus production, and difficulty in breathing. There are two main types of bronchitis: acute and chronic. Acute bronchitis is usually caused by a viral infection, such as the common cold or flu. It develops suddenly and lasts for a short period, usually a few days to a couple of weeks. Chronic bronchitis, on the other hand, is a long-term condition that keeps coming back or never completely goes away. It's most often caused by smoking, long-term exposure to air pollution, or dust and chemical fumes. The main symptoms of bronchitis include persistent cough that produces mucus, wheezing or whistling sounds when breathing, shortness of breath, chest discomfort or tightness, fatigue or tiredness. In acute bronchitis, the mucus is often clear or white, but in chronic bronchitis, it may be yellow or green and can last for months. Let's talk about the causes and risk factors. The most common cause is a viral infection, but bacteria can sometimes be responsible too. Smoking is the leading cause of chronic bronchitis. Other risk factors include weak immunity, exposure to secondhand smoke, air pollution, and frequent contact with irritants like dust or industrial fumes. Now, how is bronchitis diagnosed? Doctors usually start with a physical examination and ask about symptoms. They may listen to your chest with a stethoscope to detect wheezing or other abnormal sounds. In some cases, tests like a chest X-ray, sputum culture, or lung function test may be recommended to rule out pneumonia or other conditions. Treatment depends on the type of bronchitis. For acute bronchitis, since it's usually viral, antibiotics are not helpful. Doctors may prescribe cough medicines, inhalers, or recommend rest and plenty of fluids. Steam inhalation can also help loosen mucus. For chronic bronchitis, quitting smoking is the most important step. Inhalers, bronchodilators, and sometimes oxygen therapy are used to improve breathing. Regular exercise and pulmonary rehabilitation can also be beneficial. If bronchitis is left untreated, especially the chronic type, it can lead to serious complications such as pneumonia or chronic obstructive pulmonary disease (COPD). Prevention is always better than cure. To prevent bronchitis, avoid smoking and stay away from polluted environments. Wash your hands frequently to prevent infections, wear a mask in dusty areas, and get your flu and pneumonia vaccines regularly. In summary, bronchitis can range from a mild, short-term illness to a serious, long-term condition. Early diagnosis, healthy lifestyle choices, and proper medical care can help you recover faster and protect your lungs for the future. Subscribe my YouTube channel.